Hi, thanks for joining me. I'm Hina Joshi, and I'm going to be taking you through this 30-minute webinar where we will be discussing mental health. The webinar has been pitched for all levels of the pharmacy team, so everyone should benefit and get something out of the information that we share with you today. Now, mental health problems affect so many lives, and it's a huge issue for public health, not just in the UK, but worldwide. The topic has become very prevalent over the recent years because of the society's shift in attitudes. There's been lots of sort of tragic stories in the media that's often involving celebrities, and there's been lots of prominent campaigns that have taken place that raises awareness of mental health. And of course, the COVID-19 outbreak is unlike anything that we've experienced before. And whilst it's led to feelings of worry, stress and helplessness, it's severely impacted those that live with mental health conditions. What is good news is that there is acknowledgement and a growing awareness of common mental health conditions. And so it's encouraging that people are taking that brave step to try and seek advice and treatment. Equally, people are becoming more accepting of mental health problems, and therefore they're being more supportive to those that actually need help. So in this webinar, we're going to have a look at what is mental health. We'll share a couple of common myths and facts that surround mental health. We'll also explore the Dahlgren and Whitehead model of health determinants, or the rainbow model. We'll provide you with an overview of the different types of mental health conditions, discuss treatment options, a little bit about mental health first aid and how it can help you in your workplace, and a few tips on achieving a healthier well-being. So as you can see on the screen, we have shared some statistics with you which show how prevalent mental health problems are, not just within the UK, but worldwide. So what exactly is mental health? Well, according to the Mental Health Foundation, it's sometimes referred to as emotional health or well-being, and it's just as important to have good physical health. Now, mental health affects the way we act, think, and feel, and it also determines how we handle stress, how we deal with others, and make choices in our day-to-day lives. So by having good mental health, you can make the most of your potential, you can cope with life and play a full part in your family, work, and social life. But a person's mental health doesn't stay the same all the time, and it can change at different life stages, and we all deal with mental health differently. So it can be affected by many factors, from the moment we're born, what life experiences we've had, and family history of mental health problems. So physical and mental health should really go hand in hand, but we often find it easier to talk about physical health as opposed to mental health. Now, if you think about poor physical health, it can lead to an increased risk of developing mental health problems. And actually, poor mental health can have a negative impact on your physical health. So I'm just going to play a short video for you now, which just highlights how people could perceive physical health conditions. And the only difference is really with sort of physical health, you can see it. Whereas with mental health, it's quite difficult to actually identify that. So the video is purely for humour, and by no means does it aim to cause any offence to anybody. So I do hope you enjoy this.
And then I was like, yeah, right, man. Oh! Oh, my head!
Please don't complain. It'll ruin the vibe.
Just...
It's like you're not even trying to walk.
I'm trying.
Have you ever tried not having diarrhea?
No! Oh my god, dude! I cut myself and it looks really, really bad!
Some people have it way worse than you do. You gotta chill out.
So I guess you're not going out with us tonight. Again.
Can you hold on 1 second?
Honestly, your attitude sucks.
You taking another insulin shot?
Yeah, I kinda have to.
Have you ever thought about dropping the pharmaceuticals and fighting this the natural way?
My diabetes?
Okay, so having watched that video, it's a really good idea now to reflect on your current practice and how you support people living with mental health conditions, and thinking about how you could approach a conversation with someone that struggles with their mental health. So it's not just about how you say things. You might want to consider how you will support your customers and patients with lifestyle changes. So you could try by setting up a health promotion to act as a conversation starter. And there's quite a few national campaigns that do go ahead throughout the year, so you could take part in those to reach out to people in your community. Now, there's several different myths and facts that surround mental health, which contribute to the stigma that's faced by people today. It's so important that we challenge these myths so we can understand the real facts around mental illness. Let's just have a quick look at a couple now. So, mental health problems are very rare. Well, that's actually a myth. The truth is, mental health affects 1 in 4 people during their lifetime, and someone you may know may have been struggling with a mental health problem. There's so much help out there for people that are really struggling, but there's things that you could do that can make a real difference. For example, you could check in with your patient or your customer. Just make sure you listen to them. Don't judge. Treat them in the same way that you'd like to be treated. And people will never recover with mental illness. Well, that's actually a myth, because the fact is people with mental illness do, and they can recover. So they might not go away forever, but there's lots of people with mental health problems that still work, they have families, they lead full lives, but mental health problems don't define a person or potential in life, and recovery is possible with the right help and support. So I mentioned earlier there's been the Dahlgren and Whitehead model of health determinants that we're going to go through. So there's been lots of different models that basically describe causes of health, but the most widely used is this one, and that's what's also known as a rainbow model. So it maps the relationship between the individual, between the networks, their environment and health, and it looks at basically closing the health inequality gap. So tackling and reducing those health inequalities means it's giving everybody the same opportunities to lead a mentally and physically healthy life, no matter where they live, who they are, where they were born. So in terms of what factors can actually lead to mental health inequalities, there's disadvantages that can start well before a child is even brought into the world, which can accumulate over time and really affect future generations. So adverse childhood events such as being a victim of abuse will be quite traumatic experience growing into a healthy adult. Poor housing, so that's linked to low income and leading to stress. There's no social support back in, poor hygiene, lack of keeping warm, etc. So this can really lead to health problems in future, like respiratory diseases like asthma. And poverty, a lack of access to information, money, or health services can further increase risk of disease and mental health issues. So a lack of food, clean water, and sanitation can also be fatal. Lack of education can lead to less job opportunities and gaining job satisfaction, and also poor working conditions. Risks to mental health in the workplace include things like having no inadequate sort of attention to health and safety protocols, poor communication, not working sort of flexible hours, to name a few, which can all affect mental health and lead to low productivity and absence from work. And also having a long-term physical condition can also affect your mental health. And as we've spoken about, there's that strong link between physical and mental health. So those that have a long-term physical health condition are also likely to experience mental health problems like depression and anxiety. But it doesn't mean that mental health is inevitable or that that person has to put up with it. With the right type of support, information and signposting tools, pharmacy teams can change this, be it that you play a part in recognising the earlier signs of mental health problems, and you can take your time to talk into these people. You can advise on over-the-counter remedies to help manage those symptoms, and advice as well on achieving a healthier well-being. So for many of us, work is a huge part of life purely because we spend so much of our time working, and it's a place where we get our income. We often, you know, meet people there, we make friends, and having that fulfilling job can be good for your mental health and general well-being. But there will be times when life just gets on top of us, and sometimes that can be work related, or it can be something else like health and relationships or other circumstances. So according to the Office of National Statistics, mental health conditions is the fourth most common reason for sickness and absence in the UK. And it costs the UK economy between 74 to 99 billion pounds a year. So here is where it's really important that you talk to your colleagues, you check in with them often. Now, 68% of our waking hours are actually spent at work, so it's important that we get it right and we invest the time to ensure that there is that support available and that teams can talk to their managers. Now, we've developed a briefing sheet that's available from our mental health hub page, and you can see the links at the bottom of that briefing sheet there, but that contains some really good advice and some great information and resources that can help you and your colleagues. Alongside that as well, there are many UK mental health websites and charities that can really offer that support to people within the workplace. Now, there's so many types of mental health conditions. However, there are some which are more common than others. So in this webinar, we're going to be looking at the 5 most common ones that affect the adult population, and we'll look at the treatment options that are available after that. So we're going to be looking at anxiety disorders, followed by depression, eating disorders, schizophrenia, and then bipolar disorder. So just alongside anxiety disorders then, have you ever experienced anxiety before? The truth is, anxiety is something we all experience as humans from time to time. It's common, and it's a word that's used to describe feelings of unease, worry, and fear. And it incorporates both the emotions and the physical feelings that we might go through when we're worried or nervous about something. So it's normal to feel tense and nervous and perhaps fearful at the thought of a stressful situation or event, especially if it could have a really big impact on your life. For example, if you're getting married, you're having a baby, or you're going into hospital for some surgery, it's a really, really big decision that you've got to make. So that's why it can lead to anxiety. But when does anxiety become a mental health problem? So anxiety, as we know, it's normal. It's sometimes hard to know when it's becoming a problem for a person though. But if you are experiencing feelings of anxiety that are quite strong, or they last over a long time, it can be overwhelming. For example, you might find that you're worrying all the time, which isn't a regular part of life, or you're probably worrying about worrying. You may be a person that might find it's really difficult to step outside the house. It's a challenge because of the fear, it's that panic of being watched or judged, which might lead to fear of seeking help because they feel that they're going to be judged. And then dependent on the kind of problems that you experience, you might be given a diagnosis of a specific anxiety disorder. So as you can see on screen, we're going to just discuss these 5 types of anxiety disorders, and I'll take you through sort of recognizing the symptoms of these. So we'll start off with generalized anxiety disorder, which is a feeling of being anxious for a long time and often feeling fearful, but you're not anxious about anything specific that's happening in your life. So you might be diagnosed with GAD because there's lots of possible symptoms and effects of anxiety. So that includes headaches, rapid heart rate, sleep disturbances, sweating, nausea, and a dry mouth. phobias is an intense fear of something, even when that thing is very unlikely to be dangerous to you. If you've got a phobia, your anxiety may be triggered by very specific situations or objects. And again, same type of symptoms, very similar to GAD. So you may experience headaches, rapid heart rate, sleep disturbances, sweating, nausea, and dry mouth. And then there's obsessive compulsive disorder, or OCD, which is a diagnosis that you might be given if your anxiety leads to you to experience both obsessions, where you have unwelcome thoughts or images, urges or doubts that keep on appearing in your mind. And you may also experience compulsions as well, which is repetitive activities that you feel you have to do, such as washing hands frequently, avoiding certain objects or places, or maybe rechecking things before you leave the house, like just checking all the doors are locked. You might have to check electrical switches are off a certain number of times. And then you've got post-traumatic stress disorder, so that's PTSD. So having developed strong feelings of anxiety after experiencing or even witnessing something you found very traumatic, PTSD can actually cause you to have flashbacks or nightmares about that traumatic event, which can feel like you're almost reliving all of that fear and anxiety again. So some of the feelings that you would, or some of the symptoms that you might experience, things like panic attacks, irritability, sleep disturbances, headaches, aches and pains, and avoiding situations that remind you of that event. And then finally, panic disorders. So this is when you experience panic attacks that seem completely unpredictable and you can't really put a finger on what triggers them. So you might be diagnosed with a panic disorder. Experiencing this can mean that you feel constantly afraid of having another panic attack, to the point that this fear itself can actually trigger a panic attack. So again, you can see the symptoms include things like sweating, trembling, shortness of breath, palpitations, numbness, and light headaches. So that's anxiety disorders. We're going to move on to depression now, which is, again, another common mental health problem that affects everyday life, causing you to feel quite low in mood for long periods of time. So those symptoms include a loss of enjoyment or interest in life, unable to cope with things that you could previously do. You may feel you've gained weight or you've lost weight, and you may also have physical symptoms. So as you can see, the symptoms can range from mild, where sufferers will be in low spirits and has little impact on leading a normal life, to more of the severe cases where it can lead to sufferers feeling suicidal. So if you are given a diagnosis of depression, you might be told that you have mild, moderate, or severe depression. So this describes what sort of impact your symptoms are having on you currently and what sort of treatment you're likely to have. So depression can be triggered by certain life events or circumstances. As you can see on the slide there, that could be in relation to sort of bereavement, divorce, abuse, unemployment, social isolation, or lack of support networks. It could be a medical condition, physical illness, or it could be down to pure genetics and a family history of depression. So if you experience any episode of severe depression, you might also experience some psychotic symptoms, including delusions such as paranoia and hallucinations such as hearing voices. And these symptoms can be very real and frightening as well, which makes it harder to understand. So it's best to seek treatment and support. So there is a difference between both anxiety and depression, but it's very common to experience depression and anxiety together. Some symptoms of depression can also be symptoms of anxiety. For example, if you're feeling restless, agitated, or you're struggling to sleep and eat. Moving on to eating disorders. Now, food is a really important thing to everyday life, and most of us will spend some time thinking about what we're going to eat. Sometimes we may even try to eat more healthily. We might experience cravings, we might eat more than usual, or we might lose our appetite. Changing your eating habits every now and again is normal. So eating disorders involves a person's disordered eating behavior, and it can include eating too much or too little, or becoming fixated with weight or shape. So eating disorders isn't just about food, but it's about the behaviors that go together with it that might actually be a coping mechanism or a way for you to feel in control. So there's several types of eating disorders. So as you can see on the slide, there's anorexia nervosa, which is where someone tries to keep their body weight as low as possible. So they may do that via not eating enough, and they might incorporate that with exercising excessively. So if you have an eating disorder, you will have a distorted view of your body, thinking that you're bigger than what you actually are. There's also bulimia nervosa, which is when you get caught in an unhealthy eating cycle of binge eating and then purging or compensating for that overeating. For example, you may vomit or you may take laxatives. So just on the screen there, you can see the physical symptoms, which are things like feeling tired, constipation, liver damage. Psychological problems you may experience are things like sleep disturbances, difficulty concentrating and actually making those decisions. But eating disorders can have serious health consequences. The next mental health problem we're going to move on to is schizophrenia. So many people will experience and will have the same behaviours which can form part of schizophrenia. So it can start suddenly for some people, while others actually find it develops gradually over time. So the average age of onset is 18 years old for a man and 25 for a woman, but it can be treated and most people will fully recover. So each person's experience of schizophrenia is unique to them, but you might find that you aren't able to carry on your day-to-day activities like going to work. You may become upset or confused or distrust people, or you may be suspicious of other people. You may disagree with people who think that something is wrong, and you may feel worried or afraid of seeking help. So the symptoms that can include for schizophrenia include things like delusions, hallucinations, or perhaps false perceptions, difficulty thinking, concentrating on making decisions, and that loss of energy, that interest and emotion. And now we'll just look at bipolar disorder. So you might have dealt with patients with this type of mental health problem. So it is something that causes someone to change often from being extremely excited to being very, very depressed, and it's from one end of the scale to the other. So everyone's going to experience changes to the mood, but if you've got bipolar disorder, it can be quite distressing and it can have a huge impact on everyday life. Now, some people say bipolar is like the weather. So when it's raining, it's bad for you, but you have to be hopeful that tomorrow will be a bright day. You can't just instantly snap out of it. So having that support, especially when you're feeling depressed, can really help with feeling not feeling any sort of pressure. So some of the symptoms that are caused by mania include happiness, feeling enthusiastic and very, very optimistic. You may have rapid thinking, thoughts, and rapid speech, grandiose delusions, and you may experience quite a high self-esteem, which in turn gives you increased energy and activity, and you are also less inhibited, so you are more likely to take risks. So now we know what the common mental health problems are. Let's just have a look at the treatment options that are available. So we're going to look at the pharmacological treatments first, and antidepressants. So these are thought to work by increasing your levels of chemicals in the brain, and they're called neurotransmitters such as serotonin and noradrenaline. So those are linked to mood and emotion. So they're used in depression and anxiety. So you've got selective serotonin reuptake inhibitors. So this is what we refer to as SSRIs. So they are the most commonly prescribed type of antidepressant in the UK. It's sometimes used to treat chronic pain. It doesn't actually work immediately, but it can have side effects, but they will wear off, but you need to discontinue use gradually. It is important to note that antidepressants don't work for everybody. There's no scientific evidence that depression is caused by chemical imbalance, which is corrected by antidepressants. You've also got mood stabilizers, which are used in bipolar disorder to stabilize those mood swings. So you've got lithium carbonate, which is a really effective treatment for mania, but it's less effective at treating severe depression. You've got your anticonvulsants, so they're commonly known as anti-epileptic drugs or anti-seizure drugs. So they're used in the treatment of epileptic seizures. But anticonvulsants are also increasingly being used in the treatment of bipolar disorder. You also have antipsychotics, which are used in schizophrenia and bipolar disorder, used as an initial treatment for symptoms of an acute episode. So there's a combination of medication that may be required to treat that patient. So rather than them getting rid of the symptoms completely, the drugs may just stop you from feeling not so bothered by things like hallucinations and delusions. So you feel more in control, and leading your life the way you want to lead it. So pharmacological treatments often don't address the cause. So if it's more severe depression or other mental health conditions, a combination with therapy is required. So those are things like cognitive behavioural therapy, which is CBT. So that's most commonly prescribed talking treatment for anxiety. So it aims to identify those connections between your thoughts, your feelings, and then your behaviour, and it will help you to develop practical skills to manage these more positively. We've got counselling, which is a talking therapy, which involves a trained therapist that listens to you to understand the causes of your anxiety, and they'll find strategies to manage it. And then you've got support groups, which is where you are sharing your experiences with a group of sort of people that have had similar experiences, and it's a really good way to share feelings, your coping strategies or mechanisms, or first-hand information about the condition. So it can be comforting to know that you're not alone in this situation. And then, of course, there's bibliotherapy, which is therapy that involves books, and art therapy. So those are the non-pharmacological treatments. So due to the increase in awareness of mental health, a mental health first aid course helps people to understand the signs and symptoms of common mental health conditions. Now, they actually believe in the course that, in zero stigma that surrounds mental health, and they want that equality between mental health and physical health in being able to access that support, that people's abilities to sort of prevent that ill health from happening in the first place. So the course itself is designed to teach you how to listen, to respond and reassure even when you are in a crisis, and it could potentially prevent a crisis from happening in the first place. So it doesn't make you a counsellor, it just teaches you how to have that conversation about mental health. And you can find out more about becoming a mental health first aider by visiting the websites that are shown on screen, and we've split that via country. So as you know, in life, we experience a number of changes. Mental health problems can be triggered at any point, and for some people, there's a complicated combination of factors, although different people may be more deeply affected by certain things than others. So you can see the factors that could potentially lead to poor mental health: physical signs such as frequent headaches and stomach upsets, through to sort of emotional behavioural factors such as becoming withdrawn. So as we've mentioned, poor mental health does exist in the workplace. So here's some signs for you to look out for. So just some examples: increased errors, missing deadlines or forgetting tasks. A colleague may be taking on too much work. There may be someone who is normally punctual, but they've started to arrive late. They're working too many hours, so they're first to arrive but last to leave. They may be sending emails out of hours or when they're on annual leave. And there may be an increased sickness absence and fixated with fair treatment. So there's the 5 ways to well-being, which is a concept that was researched and it was developed by the New Economics Foundation. So they are a set of public mental health messages that are aimed to actually improve mental health and well-being. So the 5 messages that you can see are on screen. So they will aim to make people feel happier and more positive and get the most out of life. So just to summarize, connect would be to connect with your family, your friends, colleagues, and build on those relationships. And then being active is as simple as finding a new activity that you can just enjoy, find something that suits your mobility. And keep on learning, so trying something new will keep your mind active, and it's a great way to give you confidence and provide you with that sense of achievement. Give to others, so this could be a small act of kindness, from saying thank you through to volunteering. And taking notice is being more aware of the present moment, your feelings and your thoughts, so it can positively change the way or your outlook of life and how you approach challenges. So alongside the 5 ways to well-being, there's also something that was developed by the Action for Happiness that was identifying 10 key things to live a happier life. So these are not 10 commandments, because everyone is unique and what works for one person may not work for somebody else. So it's just simply 10 areas that tend to make a big difference to happiness, and it's well within your control as well. And that also includes the 5 keys to 5 ways to well-being as well. So that brings us to the end of this webinar. We have got, as I mentioned, our mental health hub page, which is filled with training, health promotion support and links to further resources and websites as well that you can visit for further reading. So there's a little bit more of information on there as well on how to become a dementia friend. So please do take a look at that website. It does bring us, as I say, to the end of the webinar. I hope you've enjoyed it and I hope you found it useful, and thank you so much for your time.